I'm going to be performing my clinical skill of changing a dressing for a central venous access device. The first thing I'm going to do is verify my provider's orders, and I'm going to wash my hands, perform hand hygiene. Next, I'm going to gather my supplies and head into my patient's room, ensure patient privacy, introduce myself, identify two patient identifiers, their name and their date of birth. Next, I'm going to position my patient into a comfortable position, and their head is going to be slightly elevated. I'm going to wash my hands again and apply clean gloves and a mask. Now, I'm going to tell my patient to tilt their head in the opposite direction of their access device. I'm going to remove this in the direction of the catheter. If there was a catheter stabilization device, I would remove that with an alcohol swab around it so I'm not hurting the patient or ripping it off or anything painful happening to them. Also, if they had a PICC line, I would measure their arm, the mid part of their arm circumference above the insertion site to assess for any thrombosis. I'm going to inspect the skin, the catheter, and the insertion site, make sure there's nothing going on, no irritation, bleeding, or anything. Now I'm going to remove my gloves, wash my hands, and I'm going to get my dressing kit. I'm going to maintain a sterile field. I'm going to open this. I don't have steri strips. If I did, I would dump them on there, onto the sterile field. Now I'm going to grab my sterile gloves. Pinch the outside of my non-dominant hand. And then my two fingers and the other one for my non-dominant. Now that I have my sterile gloves on, I am going to grab my chlorhexidine swab, and without pulling this too tight or anything, I'm going to clean around the site vertically, horizontally for 30 seconds. And then as well as the tubing, I'm going to clean that with the chlorhexidine. Now, you would use a chlorhexidine impregnated device if it was a short-term device. Also to note, if it was a gauze, you would change it every 48 hours. If it was transparent, it would be every 5 to 7 days. After I'm cleaning this, done cleaning that, I'm gonna let it dry for 30 seconds as well. Next, I'm going to grab a skin protectant, and I'm going to clean around the skin as well. Just all around the area for 30 seconds, and I'm going to let it dry for 30 more seconds. Now I'm going to coil this. Usually the tubing would coil better if I had the correct material. Okay. I'm going to usually would have steri strips to secure it. I don't have any, so we're going to pretend that this tape is a steri strip. Have this coiled and put the steri strip on. Okay, and now I'm going to get my stabilization transparent dressing to stabilize my central venous access device. How do I open this one? And I want to secure it over the entire thing and make sure it is secured and all the edges are covered. Okay. And then I would also label my initials, the time, and the date. I'm going to go ahead and dispose of everything that I used. I'm going to now remove my gloves and wash my hands. I'm going to make sure my patient is comfortable, the side rails are raised, the bed is lowered, the call light's in reach, they know how to use it, their things are near them. And I'm going to document the expected outcome, that it was clean and everything, good happened, the dressing went well, and the response of the patient. And I'm done.